As we age, back pain becomes a serious reality. Joining us today is Dr. Sneddon with Bingham Healthcare, and thank you for joining us. And this is kind of a big issue because I know a lot of people who suffer from back pain. What are kind of like the 2 or 3 leading causes of that?
Generally speaking, we're talking about things like herniated discs or spinal stenosis or narrowing of the spinal canal or degeneration of the facet joints, which are the back part of the spine.
Okay, and you know, the back is probably one of the biggest areas of our body, and there's a lot that can go, there's a lot going on there every day. And it seems like sometimes all you have to do is sneeze and it's like, oh, there goes my back. So before, what has been kind of like the traditional or the most common methods of treating that kind of back pain?
So generally speaking, your most common treatments are your chiropractic care, your physical therapy, and when those types of modalities don't work for patients, then they come to someone like me, where we talk about things like epidural steroid injections for pain in the spine that radiates down the leg, either from a herniated disc or, again, that narrowing of the spinal canal, what we call stenosis. Sometimes we do what we call facet joint ablations, where we burn small nerves in the back part of the spine. And that's for patients who suffer from chronic low back pain that does not radiate down the leg, just kind of stays in the back.
It kind of localizes it?
Correct.
So tell me about this new procedure that you've been doing, and how is that helping your patients?
Yeah. So this new procedure is called basivertebral nerve ablation. Another name for it is Intracept. What's different than this is we're treating more pain that comes from the front of the spine, where the bone and the discs are. Whereas previously we've been focusing on pain that generates from the back part of the spine, as I discussed earlier. This procedure, we're targeting a nerve inside the bone. So we're basically treating bone pain. In fact, CMS has created a new diagnosis called vertebrogenic low back pain, which is different than back pain that comes from the back part of the spine. So, yeah.
Yeah, and so what kind of success have you seen from these type of procedures?
Yeah, so in the original study that showed this success, it was about a 70 to 71% success rate. In my practice, so I've done 100 cases. In the first 50 cases, and I haven't looked at the second 50 cases, I haven't gotten to that yet, but the first 50 cases, our success rate was about a 78 to 79% success rate. So pretty cool.
So people are able to get back up, get back to their quality of life, and get back working on their back. And so if somebody has symptoms, what kind of symptoms are you looking for that would qualify for this type of procedure? Typically,
but not always, these patients are a little bit younger than the traditional chronic pain patient. So somewhere, you know, under the age of 65.
Kind of my age, so. Let's just say that.
Their low back pain, historically, we were treating patients who had pain with bending backwards or twisting. This is somewhat different. Their back pain's aggravated by bending forward, leaning forward, sitting for too long. And again, the cohort's a little bit younger, but I've treated patients as aged as 80 all the way down to the 20s,
Okay, fantastic. And if you'd like more information, we're going to post this on our Facebook page and on our YouTube page. And if they need to contact you, just contact Bingham Healthcare and they'll put you in touch. All right, Dr. Sneddon, thank you so much for joining us today.
Thanks, Matt.